President Bola Tinubu approves increases in retirement age for doctors and other healthcare workers from 60 to 65 years. Now, I was expecting that doctors who must have gotten to that age, 60 or 65 years, even when you are done, 65 or 70, and you still have the physical strength, you know, there is a plan, there should be a plan by the federal ministry to train, not just only to train, but to retain and to train the incoming generation from medical schools, from our tertiary institution. And I think the best hands that should be saddled with that responsibility are those who have practiced for more than 35, 40 years, and they seem to be leaving the stage for the younger ones to come. But it doesn't look like we've been able to make or generate any policy framework to keep them here. And rather, we see the young ones living in droves.
Yeah, and I think that's the real problem, because you have a situation now where all young people, they want good life for themselves. And then, of course, your system has not been able to promise this good life in terms of remuneration, in terms of package of what they pay, or even creating an environment where, of course, professionally you can also grow. So there are a whole lot of considerations, and somebody is working, and you need a quota system to determine whether you can get to certain cadre or move up to a certain level, and of course fund is not coming. And so people are looking for where they can have opportunity to have a good life, and that is not coming. And what do you see? Young people as moving out in droves to other clients, and now the head institution itself is the one suffering. And I think maybe what this is also do to see how to also cover that space or ground that this vacuum has also created. Now, there's also a place of where maybe because of the dysfunctional nature of our education system, that is not even really producing the necessary manpower that's required to do real, I think the way it is in other disciplines. And I'm not sure the medical discipline is left out.
Okay.
So people really don't have the requisite skill to do what is appropriate. And so somebody is saying to you, well, why do we have to allow some certain people to go? I remember some years ago when my mother was sick, and I took her to a public hospital, and they did all manners of tests. And one of the doctors said to me, so I don't trust what these guys are doing. I said, please, can you go and do this test for me somewhere? And this is a retired person, and said, because I'm sure of what he's doing. Now you are living in an age where people put headset on their ear, and they are listening to music or listening to sick, and they are doing some work, and there's no attention and concentration. So these also are issues that people are also considering, and even professional people are also not taking and saying, well, why do we retire people who still have energy to work when we don't even have competent hands to fill up those space? So all this consideration may be what's responsible for that increment that we see. But I think it's actually very retrogressive. And I think that when people get to some certain age, they should go and rest and allow the generation that is before them take over the space.
I don't think it's retrogressive, and I don't think that increasing the retirement age of health workers from 60 to 65 means that there won't be space for those who are incoming or who are just leaving school to get into the system. Because if you check the medical sector now with the Jackpot syndrome, a lot of people have left. Many of them young doctors, resident doctors, because of the poor welfare package for them. And even when they say doctors are going on strike, check, most times it's the resident doctors that are going on strike. The consultants and those big guys here, those who've moved up the ladder, are still around. But because they need the resident doctors to function, so you would easily see the effect, because some of them don't really do the work anymore. They are only consultants who do more or less play supervisory roles. So those who actually get on to do the work are the resident doctors. So if you're increasing the number of years before they can retire. It means that you would have that experience, or you have the experienced people stay for a longer time, so they can actually mentor, and where their services are needed, then they can offer. But I think what we should be looking at more is expanding the personnel, increasing the personnel that the health sector has. Now, if more people, or if a lot of people have left, there are still doctors who are graduated, who just left school. There are still doctors who have just been inducted, newly inducted, and looking for a place to work. Some of them are in private employment, where they're not even getting close to what their colleagues who are under government employ are receiving. So it's not as if the system is choked to the extent that it can't accommodate more people. But I know that wage is another thing that government may consider. So how then do you pay these people? But some of these hospitals, private government hospitals, are also generating money. So let's also look at that. Apart from medical services, some have gone into business ventures. Some have cooperatives that are big now and generating funds, even though some of the profit still comes back to staff members who are part of the cooperative. But a lot can be done so that you can take in more people, because I don't think that we even with them still being on ground, we are able to cover ground. The research was done some time ago, and it said in Nigeria it is 1 doctor to about 1,000 patients. Now with the Japa syndrome, I know that has increased. So if we bring it to, if we can bring it to
1,500 people.
Yes, if we can bring it to as low as 500, which is still much for 1 doctor to 1 patient. That's some progress. There's room for all. There's room for more, rather. And I think that us thinking as a people that when people are 60 years of age, 65 years of age, it means that they're done. I don't think it's good enough, because some of them at 60, 65, you're even finding it hard to believe that they've got into that age. They still have a lot to offer, because when they leave and then they become senior citizens, what do they do with their time? Apart from the medical sector, when those who are in lecturing, those who are in the academics, when they leave, when those who are in civil service leave after 35 years of service, what do? Some just go back home and idle away. It's only for those who've been able to set up one business venture or the other that move on to their personal business. So they may not actually be in full employment. At that age, they can still move up to maybe part-time workers, so that they are still relevant, they are still productive.
Yeah, but I feel as society evolves, especially in Nigeria, where you have our average population put at between 17 and 19, it's retrogressive. We can talk about that in places in like Western Europe or some deep Asia, where population is declining as a result of age. So you don't have younger people to fill in the space. You have alluded to that, Blessing, that you have even young medical doctors who leave school, they don't even have a place to practice. They don't have a place to practice. Some of them can't be engaged. And now, you are extending the age of those who are already in the space. So I think it's creating space for other people. And what people do in other climes, which of course again is not common here, is this act of volunteerism. We're asking people who have energy and they have so much to do. In other climes, they just volunteer to give back to society.
But doctor, giving back to society, is on 2 sides. Those claims you talked about, sometimes the government in those countries pay security, even if you don't have a job. There's this
Social
income,
security.
you have social security. And it's a claim whereby you're also giving...
Social security are given to people without employment, not people who are retired. So what I'm saying is that...
people who have retired too...
No, they don't need social
back
security. So what they need is that their pension come regularly and they are living. When they get to a certain age and the pension is not able to take them, then of course social workers come around them and assist. But what I'm saying in essence is this: if I'm 60 years and I'm a teacher and I'm retired, and I'm looking at what to do with my time. My pension is coming. All that now is that I need a time for myself. I can volunteer myself at my own expense to say, okay, there's one secondary school in my neighborhood.
Not at 60.
And I'm going there to say to them, I said, well, I'm here and I'm going to contribute to this environment. I can even, if I'm a medical doctor, stay in my local environment with my table and chair, and I say to people from 10 a.m. in the morning to about 1 p.m., I just take your vitals and consultancy, and I'm doing that, and it keeps me busy all my life. And then, of course, what that is just creating the space for other people to take advantage and also have the benefit for working 35 years for government. At least that should be enough. Yes, I agree with the part that pays are not good. And I think those are the area where we must begin to create a lot of incentive for the system.
Okay.
But when you're having so much young people who are not employed, and then, of course, people who are employed, some of them who have doubled their age before coming into the service now, and they are also having an extension. It's a very big problem. Some people retire from public service, and then they are already in 80. So these are things that we also must see in our system, that people don't want to live. And that's because, I have always said this, people don't plan for their
retirement
tomorrow. So as people start to plan for their retirement, get to a certain level that people even retire early. In the church circle, my friend told me a story some 2 years ago, and he said, this guy, he said, retirement age for priests in our own communion is 70. And the man at 55 said he wanted to retire. And he said, it's still early. He said, look, I've served the church for too long. I want to use the red part of my life to serve God. You understand that kind of mentality? So you don't staying put to say, I'm going to die here. I cannot even raise your arm again. Arthritis is holding you down, and you are still sitting down working. So, and there are young people who can do those work. Those are roaming the street, carrying application from place to place. That's why I said, for me, it looks quite retrogressive.
All right.
Well, for those ones who may not be physically fit, I think it's for the organization where they work or the institution to know this person is not fit anymore. So there are duties you can give to them. There are ways you can restructure their employment and the way they work, so that it is not because the law says yes, it is not because the law says 65 years and we're seeing that you're not fit and you're still there. Yes, people doctor their age because they want to stay longer so that they can also get more, and it's a reflection of the poor pay system. Because if you're able to get if you get good pay and then your pension comes regularly, you're even sure of the pension coming regularly, I don't think that would have been a culture for people to want to live and die in civil service. So we see pensioners often in some ministries, some of them not getting their pensions as I went doing. Even gratuity, some are still struggling to get it. So these are part of the issues. Not everybody wants to go through that. So people would rather doctor, not that it's a good thing, rather doctor their age so that they can keep receiving the full benefits while they are there. Well, I think if we can get all of these things in place and get them right, it will reduce a lot the rate at which we have this doctrine of age and people leaving school not being able to get good jobs.